Welcome, everybody, to the EQPOD podcast brought to you by Botu Pharma USA. Today, I have a very special guest, Dr. Camilo Hernandez out of Texas A&M. Dr. Camilo, welcome to the podcast.
Thank you so much, Ty, for having me here, and thank you so much for extending this invitation to talk a little bit about the stuff we do. My name is Camilo Hernandez. I'm originally from Colombia, the country. I'm a veterinarian, PhD, board-certified equine throgenologist, and currently I'm an assistant professor of equine throgenology here at Texas A&M University called Station, Texas. So I basically provide clinical services for equine client-owned animals here at Texas A&M University, some off-site consultation for stallion and mare breeding operations here in Texas as well as in other states. Also have spent probably half of my time conducting regionally based research, and my particular focus is on stallion reproduction, and I work a little bit also with some of my colleagues here on assisted reproductive technologies in horses.
Awesome. And you'd mentioned the stallion side, so that's exactly why I want to bring you on. If we're not at the end of the breeding season, we are in the thick of breeding season. So I kind of want to talk to you about some stallion management issues, particularly about semen handling, whether that be, extenders, without talking brands, because I don't like talking brands on this show because I could easily be very biased and push my own brand. But as far as semen handling, let's talk about some of the small mistakes that cost pregnancies, whether that's common errors in collection, what matters most in the first hours of collection, and where do most breeding programs lose their quality?
I think that you bring out probably, I wouldn't say it's just a trivial point. I think it's the most important point that matters when processing stallion semen. And I think that no matter what kind of extender you use, if something doesn't go right during just the collection process by itself, you can ruin stallion sperm quality and even ruins the stallion breeding reputation. So to me, I always like to use this quote that the essential is invisible to the eyes, because people used to think that there are very trivial things that they just take for granted, like how to wash the stallion's penis. So do you wash it? Where do you wash the stallion's penis from? From the tip of the glandis all the way to the base of the penis, or from the base to the penis to the tip of the glandis. Some people don't dry out the stallion's penis, which to me is surprise. You're washing the stallion penis with water, and then right away they just go and collect the stallion, and there is water residues on that stallion's urethra. Whether or not that amount of water might affect sperm quality, it depends. It depends on quality. The quantity matters, but certainly it's not something that you should take for granted. The amount of lubricant you add, not all lubricants that are commercialized as spermicidal truly are non-spermicidal. There was a study, probably 3 or 4 different studies have been done since 2001, and the most recent one was actually done here at A&M in 2019. And in that study, we compared multiple brands of non-spermicidal sterile lubricant, and we found out that a couple of the most common ones that people like to use actually were quite toxic, even at low concentrations, were quite toxic for sperms. The brand of the brand of lubricant matters. The amount of lubricant matters. I'm surprised, and talking with some people and visiting some farms. I'm surprised that people easily squirt a full bottle of lubricant. They assume that just because that's the way to go. We normally tell people you don't need that much lubricant. This size of drop of lubricant should be enough to lubricate an AB. And, if, for instance, if the stallion doesn't ejaculate in the first jump, they just go back again and squirt more lubricant and keep on going. And all those things start to matter. The AB type matters. The latex that the AB is made of also matters. I think that one of the nicest things about what I do here and being in academia is that you always have a clinical problem, and that clinical problem translates into a research question that then can go back to the clinical arena. I know an example of one of my colleagues, Charlie Love. He had a nice case of a stallion that was brought in because the stallion had zero motility after being collected. And, sperm quality and morphology look okay. He came in here. They were collecting the stallion in the artificial vaginas we had here, which are from a specific brand, and they couldn't see any problem. They say, hold on, but you're having problems at the farm, but no problems here. Why don't you just bring your own AB? So they brought their own AB. They collected on that AB, and it happens that the latex that AB was made of was toxic for the sperm. And that led into a project that they did here, in which they compared the effect of different latex made from different brands of artificial vagina and how those can affect the sperm quality. So the latex matter, the amount of lubricant, the type of lubricant matters. Other thing that I think it's important, and we always emphasize people, your goal, if you're collecting semen from a stallion, you should make sure you try to collect that ejaculate on the first jump. And often people collect semen from stallions and takes them 2, 3, 4, 5 jumps, and they use the same AB, they squirt more lube, and all, if you use the same AB, you all get a bunch of epithelial cells and debris, and all those things end up being in the collection receptacle. So at the end of the day, if you get the stallion collected, you get sperm, lubricant, and a bunch of gunk where the sperm is going to be attached and bound, and that affects the longevity of the sperm in the short term or even in the long term. So what's the recommendation? If for some reason you cannot get the stallion collected on the first jump and you have to do processing like cryopreservation, centrifugation, whatnot, it's better to get yourself a fresh AB, wash the stallion's penis again, and just start all over the process again. So very essential things, very trivial things, but they do affect tremendously the quality and the longevity of stallion semen.
Do you feel like when you help out with, let's say, a newer program or even a program that's been in the business for a while, where do you think they lose the most quality in that stallion or any stallion?
I think there are two factors. One factor is the stallion by itself, the stallion intrinsic sperm quality. It's a big it's a big problem because there are stallions that have great sperm quality, great sperm numbers, great morphology, great DNA quality. Those stallions should be highly fertile. And you have obviously stallions that don't have that sperm quality, don't have those numbers. Could be stallions that just came out of the racetrack, the show pen, or could be stallions that are aging, right? And often these breeding operations, they don't pay attention to those details. And then they find out that they assume that the stallion that they collected 2, 3 years ago, semen, and used to breed 100 mares in a breeding season and get 90% of those mares pregnant. They assume that the same holds true for this year. And so they book into the same number of mares, and it happens that that stallion might not be producing the same sperm quality that he produced 2, 3 years ago. So one thing is taking things for granted. So those stallions, I'm a firm proponent that every stallion should be examined for reproductive soundness at the beginning of every breeding season. You want to make sure what kind of stallion you have to work with at the beginning of the breeding season and make changes accordingly. So that's one thing. And the second thing, and we say here all the time that the biggest factor that affect horse fertility, not only stallion but mare fertility, is the management. And like I said, management, like taking like all these things that you just mentioned before, how to prepare the ABs, how to collect the stallion semen. I have heard people saying, I have been doing this for 30 years. I have never had a problem before. And that's fine. I respect that. But often you find out that those very same things that they assumed that were fine and were not affecting their stallion, now they're affecting their stallions.
Yeah. So you actually touched on something that I kind of want to ruminate on a little bit more, and that's the topic of reproduction soundness. When you say that they should test for that, obviously the beginning of the year, what does that entail? Like, are we just testing, obviously if the horse is fit, the diet? Are we testing extenders? Are we testing different, methods? Like, what is the full scope of reproduction soundness?
I think that it's a combination of all these factors you just mentioned. Certainly, gonna have a sound stallion, an animal that is not sound, that is not physically sound, that is lame, that has pains, is not gonna be able to reproduce well. So it's this typical stallion, for instance, it might have leg pains, it might have back pain. That might be the stallion that is taking you 3, 4, 5, 10 jumps to get an ejaculate from, if you get an ejaculate. So the primary problem is not the lack of ejaculation, is what is causing him to not ejaculate in the first jump. But that primary problem is being reflected, and it's taking you a lot of times and a lot of effort to try to get one ejaculate. And you got all these other things around that might affect that stallion ejaculate quality, right? So that's one thing. Certainly, you want to make sure that the stallion is producing a sperm and what quality of sperm he's producing. And I understand, like the simplest assay to look at is collect semen from the stallion and looking under the microscope. If they are moving, the assumption is they're fine. But are they fine just because they're moving? So if you think about a sperm A sperm cell, it's a very complex, it's a simple cell, but it has a lot of complexity of what it has to do. So just imagine the cell being deposited in the male uterus, having to travel all the way to the oviduct, hanging around in the oviduct, staying there, changing, undergoing these changes that required to acquire fertilizing competence, release from the oviduct at the right time based on signals from the oocyte, traveling around these cumulus cells, trying to break through them, binding to the zonad, delivering the DNA paternal and activating that oocyte. So if you think about that, it's a big task, and the motility by itself is not going to be able to tell me all these factors. So do you have to do a whole battery of assays to be able to say, oh, this stem is fertile? Maybe not. Having multiple sperm quality assays can help you to look for those individuals that are questionable, but just the motility by itself is not going to tell you anything. And one thing that I think that when people have a stallion examined for breeding soundness, they need to make sure that not only the sperm are moving, what's the quantity of sperm that the stallion is producing? Does that quantity correlates or coincides to what he should be produced based on his testicular size? What his testicular size is, because that will dictate how many mares can I book the stallion for this season. Is this stallion that his testicles are big enough and are producing good quality enough that he can put to 200 mares per season, or his testicles are not that big and they're not that efficient producing sperm that maybe 100 mares or 80 mares will be as much as he can breed this season? What's the quality of the sperm by itself coming out of the testicle? I think that one of the assays that is most often underlooked because it takes time, but it's probably one of the best assays to look to tell sperm quality is sperm morphology. It's a true reflection of what's the capacity of those testicles to produce good quality sperm. And you can have sperm cells that are moving, but they might have morphologic abnormalities. Depending on the incidence of those abnormalities, depending on the breeding method you're using to breed that stallion, they may not have an impact on fertility. So there have been studies and that have been done. For instance, I'll give you to me, it's a classical example. Sperm with proximal and distal droplets. Those sperm with proximal distal droplets are considered to be sperm that are to a certain degree immature or not. They come from the testicle and reflects a testicular problem or reflects a epididymal problem, if you will. It's still uncertain. I think that it's more complex than just classifying as primary secondary abnormalities. But there was a nice study done here back in 2000. In this study, they took 17 stallions in central Kentucky. Every time that one stallion covered a mare, this mount sample was collected, and they look at the morphology of that specific sample for that specific stallion and how was the pregnancy outcome from that cover. And they found out that under those breeding circumstances, which is live cover, highly fertile stallions, proximal and distal droplets didn't have a negative impact on fertility. But let's flip the coin and have the same stallion breeding mares by artificial insemination with cool semen or frozen semen. Proximal droplets, sperm with proximal droplets and distal droplets can be motile. They are motile. They can be viable. They survive well the cooling and freezing process. But when you're starting to reduce the number of sperm you inseminate a mare with because you're trying to accommodate multiple breeding doses per ejaculate, maybe that sperm that you're assuming is motile is competing with normal sperm to fertilize an oocyte and might be hampering the fertility rates for that specific dose. So semen evaluation and sperm quality assays, it depends on what you're looking at, and it depends how you're breeding these animals, may have a higher or less higher impact on how do you examine those stallions, how do you make clinical decisions about them, and what recommendations you do to the breeder. And that's why it's important that when somebody's having a stallion examined for reproductive soundness, all these things are discussed. You need to know what are the owner's expectation, what do they want from this stallion, how many mares are they expecting to breed. Based on the results of the analysis, discussions need to be held in which the person says, this is my examination, this is what I see, this is what I think the stallion can do under these circumstances, and the owner or the breeding manager should be able to say, I can accommodate this, I can do this, or this is too much to me. I don't know if I'm going to be able to do this. This is not going to be economically feasible to me.
How far in advance of the breeding season would you recommend this type of soundness exam?
So I think it depends a lot, Ty. So if it's a stallion that just coming from the show pen for the racing track, for the racetrack, some stallions, we examine them in kind of like in the late fall, November, December. Some stallions, we examine them February, early March, depending on when people start to breed those horses. But other times, we also have stallions that we have to examine right in the middle of the breeding season because the breeding sinus examination, the only thing that can tell me is it's just taking a snapshot from that stallion, how they look today, right? The stallion today has certain sperm quality characteristics, certain reproductive characteristics that I can think will coincide with those of highly fertile stallions, but I don't know what will happen next week. Does the stallion get kicked in the scrotum by a mare? Certainly is going to be a problem, right? So he needs to be examined after all these problems are solved. I can see the stallion, let's say we're in February now, I look at the stallion and it happens that in April, his pregnancy rates are not as high as expected. Might not be a bad idea to re-examine the stallion again and see if something changed. It depends. It telling you, oh, you need to look at them every month or right at the beginning of the season might work for the normal stallion, routine stallion, but owners should not only, breeding managers should not only think that the BSC is going to predict what's going to happen. They need to have their stallions examined accordingly if things might change or if the pregnancy rates or the reproductive efficiency is not as they expected.
Sure. No, and that's a good note because I don't want people to think you do the soundness exam at the beginning of the season and you're good, right? Like, no, it's kind of you have to pay attention to your horse. A good breeding manager, a good breeding program is going to say, hey, there were some issues. Like you said, the horse gets kicked, or maybe the horse just took a weird fall and it comes up lame. Lameness is a huge deal when it comes to a stallion. Like you said, if it can't mount, it's probably not going to feel good to, collect or at least give a collection.
And other things that people can do in the midst of the breeding season that can help you to kind of like monitor those stallions. For instance, when we work with people who have thoroughbred stallions, we often tell them, like, if you're noticing that pregnancy rates are not as they should be, or you're noticing a decline on fertility of the stallion, thoroughbreds, the collection of these mount samples is a common procedure. And these mount samples, they are not only examined by the veterinarian on the farm just to ensure that the stallion ejaculated or not. It should be looked at least to get you an idea, a rough idea what quality sperm semen you get. And if you still have doubts, those samples can be saved, can be fixed in formalin, can be snap frozen, can be sent to a laboratory, can be sent to a private clinic that may have more equipment or might have a specialist to look at them. And you can do those samples throughout the season and you can monitor how the stallion is doing. Same thing for people who are working with artificial insemination stallions. Every time that you're collecting semen from the horse, you should look at the semen and you should notice whether or not things are changing. And when things are changing, then you make this call and say, I don't like what I see today. And 2 days ago, it was exactly the same. Might not be a bad idea to send a sample to a reference lab, to a private practice, to have somebody else looking at the semen if you cannot do it on your own practice or on your own breeding farm.
So then how would you, advise somebody that, yeah, their stallion's pregnancy rates drops? How do we talk about, is it the stallion that's the problem or the mare that's the problem?
I love that question. Sometimes if I get that same question asked and some people say it's not a loaded question, and I don't think you're making a loaded question at all, but it's interesting because I think that quite often, if a mare doesn't get pregnant, the first one who gets blamed is the poor stallion. And does that really is due to the stallion? It's not that often. And I'll give you an example. There was a study done here too. And I'm not quoting the studies just because we're down here. I'm just saying because those are the studies that I think we need more data on that. But there was a study done here at least that I can talk about because I know the study quite well. And this study involved a big quarter horse breeding operation, 2025 stallions. One thing that these stallions had is that the sperm quality overall was quite similar. So, what you will say, acceptable sperm quality. And that study showed that when you see that the sperm quality of the stallions is acceptable, the primary factor that affected the fertility of those stallions was the mare ID and the mare age. The second factor that affected the fertility of those stallions was the breeding method. Breeding mares with fresh semen versus cold store semen. So, and that study actually showed that, and don't quote me with the specific percentages, but about 20%, maybe 30% of the breeding equation was stallion related. So you got 70% of that breeding equation that's either mare intrinsic fertility or, more importantly, management. So something we do when we have stallions that are presented with reproductive problems, we ask people for the breeding records. And that's probably the most difficult task we have because not everybody's good keeping records. And it gets more complicated when you're dealing, for instance, with artificial insemination programs in which you have embryo transfers and you got ICSI and you got frozen semen and you get that the mare gets bred 3 or 4 times in the same cycle. But when you can try to look at through those records, you start to find out that, for instance, you have a stallion that has these fertility rates, and what you can do, you can start to break out how that stallion did with by mare types. So if you got stallion breeding to young maiden mares, those should be the most fertile mares. How's he getting them pregnant? If he's getting them pregnant efficiently, then you go to the next one. How's he doing with foaling mares? Foaling mares, unless something happened during foaling, should be fairly similarly fertile that young maiden mares. How's he doing with those? Then you start to look at the barren mares. And then you probably most of the time you start to find out that some of these stallions, they do quite well with the young fertile mares. They do quite well with the foaling mares. Their problems are their barren mares. And then you start to weigh, okay, of his book of mares, what's the percentage of mares that are young maiden mares versus all barren mares? And you find out that the data is skewed because he's got a bunch of old barren mares booked to him. That's probably his problem. You see what I'm saying? So
Yeah.
those breeding records are very, very helpful. Breeding managers and owners should make sure that breeding managers and stallion owners should do an effort to keep those records as detailed as possible because it helps veterinarians to try to address whether you have a stallion problem or you have a mare problem or you have a management problem. Like, for instance, if you have a stallion that you're constantly seeing that his mares are being bred 1, 2, 3, 4, 5 times in the same cycle, you start to think about probably is not him, probably is not her, maybe it's her, but why a mare is getting bred multiple times on a cycle? Is she cycling properly? Is she doing what she should be doing? Is whoever's breeding that mare timing that mare in a manner that insemination and ovulation are properly synchronized? So all those questions start to be raised just by looking at the breeding records. Then the next step will be looking at the stallion sperm quality. So if you notice, for instance, that the stallion has poor sperm quality to begin with, low motility, low normal morphology, high incidence of abnormalities, low sperm numbers, then you can still say, okay, maybe this is his problem. But you need to look that in the context, okay, do you have a stallion with poor sperm quality, but on top of that, you got all barren mares that are being bred to him. And on top of that, you get management that is suboptimal. Well, man, you got a cocktail of a lot of problems there. For sure, nothing's going to get pregnant.
Yeah. No, I kind of want to change it up a little bit and go a different direction, but staying with the stallion, what makes for a good extender, right? If we're talking fresh cooled, what is it about a good extender that is going to help the stallion versus, hinder the stallion?
I think that I'm gonna give you my I think that the extender is as good as the person who's using it. So you can have a perfect extender that is perfectly formulated, balanced, but if the person who's using it doesn't know what's going on or what they're doing, you can ruin an ejaculate easily. If you look at what most of extenders made of, they are made of some source of proteins because the sperm needs some sort of proteins, particularly milk proteins. Could be just skim milk, it could be purified fractions from milk like caseins or native phosphocaseinates. They need that because those proteins help to protect the membrane against cold shock. We're running some studies about that because we want to try to understand more how this process works. Some additional study extenders may not contain additional molecules that provide additional protection to the sperm membrane. All these extenders have an energy substrate, and I'll say that 99.5% of them, they have glucose. Is it glucose the best energy substrate? We don't know. It has been used for almost 70, 80 years, and it works fine. that imply that you should use glucose-based extenders based on what we recently know about how stallion sperm produce energy? Maybe no. It should have an antibiotic. What antibiotic, what concentrations? It depends a lot on what situations you're dealing with. And I think that, and if I can make a little parenthesis here, the idea of having antibiotics in the standards is not to control or to avoid or eliminate complete bacterial growth from a sample. As a matter of fact, raw stallion semen is not unusual that it has some bacteria. The question comes, what kind of bacteria and what quantities of bacteria you have. But if you culture raw semen from fertile stallions, I'll be surprised if you don't get any bacteria. That doesn't mean that you did a poor job collecting the stallion or cleaning the stallion. It's not a sterile procedure itself. And the antibiotics and the standards are not meant to completely wipe out that bacterial populations. They are meant to limit the amount of bacterial growth because at the end of the day, the extender is a bacterial growth culture broad as well. So the extender has the same nutrients for sperm as for bacteria. So you just don't want to have a bunch of bacteria growing there, even those commensal bacteria. But it should have a combination of antibiotics, broad spectrum antibiotics. And besides that, any other additives may have not been shown that provide better or lower protection to the stallion. So I'll say just a good energy substrate, some antibiotics, and some proteins that protect the sperm membrane from damage during cooled storage. But again, and going back to the which one I think is best, I think that it depends on how do you manage the stallion. So for instance, I can have an extender that is loaded with cholesterol and caseins and lactate or pyruvate as energy substrates and has penicillin amicase. I'm just saying these things, right? So
Yeah.
I'm saying a specific extent. But it got a stallion that it took me 4 jumps to collect semen from. So it's a very dilute ejaculate. And if I'm expecting to treat that ejaculate and just doing a 1-3, 1-4 dilution ratio and send it off, believe me, it's the best extender in the world, but it's not going to protect that because I got a bunch of debris, I got a bunch of cells, I got a lot of seminal plasma that can affect the longevity of that sperm. So everything goes back to how do you manage, which tools do you use, and how do you manage that ejaculate?
Now, you bring up a really good point as far as like management. Do you have any, either a funny story or just a case study of like, hey, this is what happened. They could not figure it out. And, it was in their protocol of how they handled from collecting it now to processing it. Do you have any, firsthand experience of like, no, this is what caused it? It wasn't the extender. It wasn't the stallion. It was the handler.
So it's probably the most common story that we face when we get the consultations of my stallion is not doing well, he's not impregnating his mares with cool semen or even fresh semen. Probably the most common example is a stallion that particularly it for some reason happens mostly with young stallions. So stallions that just came out of the show pen and they become really, really popular. So the owners just start to see, money floating around. So they say, people start to say, "Oh, I want to book him to 100 mares, 150 mares." And these people, this person who was doing the reproductive work of the stallion, they say, "Sure, I mean, we'll just collect semen. Semen looks good under the microscope. They want 10 doses for today because he's got 10 mares booked today." And they were collecting the semen. They were diluting 1-3, 1-4, shipping it out. Mares on the farm were getting pregnant. Mares outside were not getting pregnant. So I went to look at the stallion and say, okay, so let's see what we have to deal with. So look at the semen under the microscope, look at the morphology. It was acceptable sperm quality. And then when I started to look at how much sperm he was ejaculating, how big his testicles were, I found out, well, I mean, the stallion is doing the best he can, but right now, he is not the stallion to be booked to 10 mares per collection. He's only producing 3-4 billion sperm per ejaculate. He can do probably maybe 2-3 mares a day. So, and he's giving you really dilute ejaculates because he's being over teased and he's seeing mares constantly. So every time that they collect semen from him, they get 100, 120 mLs of volume of semen. Well, you cannot just process this semen by simple dilution. Your best option is collect the stallion, centrifuge the semen, concentrate the doses, know how much sperm you have, and just divide that in no more than 2-3 mares. That's as much as the stallion can do. Then the samples should be centrifuged, ship out. Some of those were inseminated on farm by transrectally guided deep horn insemination. Some other ones, they sent it to some farms and they were not happy because they were not familiar with the insemination technique. So you just extended them a little bit after their centrifuge, and some mares got pregnant, some other ones didn't got pregnant, but he was a stallion that went from having no pregnancies after 15, 20 shipments. He had about 12, 13 pregnancies in 20 shipments. So, and he was just paying attention to the detail.
Yeah. So, you're in academia, but you actually are actively, obviously within the breeding world. One of the things that I've had a hard time getting people to do is looking at scientific data and then using it on the farm, right? Because I feel like, and correct me if I'm wrong, there's kind of a separation between research and actual application of that research. Why is good research not always showing up on the farms?
That's a good question. I guess that probably us in the ivory tower academia should do a better job about communicating our findings for sure. Engaging with people, maybe inviting people to come to the universities and seeing how we think we do things and how things we think should work. I don't know. I think that also, and this is something we talk with the students every once in a while. I think that amongst the different veterinary medicine specialties and amongst the different animals we deal with as pterogenologists, probably the equine reproduction is one of those in which there is still too many myths, you know? There are too many myths, there are too many things. And once, goes back to what we talked about before. Some people come and say, I have been doing this for 30 years and mares are getting pregnant. So they say, why would I change something that it works for me? And, that's fine. But some people assume that mare A or stallion A should be a stallion B, a stallion C, and stallion D and manage them all together the same way because it's convenient. And I think that probably some people just don't want to be told that maybe they could do better. And some people will say like, I'm not saying that what we do in the universities is better and everybody don't know what they're talking about. I think that there are a lot of things that I as an academician learn from people who are in private practice. There is a lot of stuff that I learned from them. I was like, oh boy, I never thought about this. This is quite interesting. They are the ones who are seeing this every single day of their lives. I think that one thing is that everybody needs to put themselves on the same level and being humble about to what they know and what they don't know and start from there. And that goes for like my job as academician is that if I'm coming out with a research paper, I'm not just doing a research project to get a publication and that's it. I try to every project that I do tries to solve a clinical question that I've seen myself. That I'm wondering, say, I don't know why we're doing this. Then my job once I finish this is to tell people this is what I saw, this is what I found, this is what I think could be matter. It's up to them to decide if they want to do it or not, but at least this is what I saw. So we should be better communicators, but people need to also be better listeners.
Yeah, what I found in my day job with Boat to Farm is that if I come from a position of, hey, I think your program is lacking in an area and I try to get them to change, they will dig their heels in and they will not change. But if I just say, hey, here's what studies have been showing that if you tried this, if you have a problem mare or if you have a problem stallion, just try it. Then they're more open to trying it. It's a finicky relationship because I can't tell a vet or a breeder that's been doing it, like you said, for 30 years to change. That just, it doesn't work. But if I just say, hey, have you ever thought about it? And even if I just say, hey, you can have it, that's your idea, or make them feel like it's their idea, they're more apt to try it, which right, wrong, or indifferent, at the end of the day, if I can get them to try something new, that's a win for the industry.
Yeah, yeah. Now, one thing that also I think that people need to realize, and I always tell veterinary students that one of the beauties of working with horses is that you almost do like customized medicine. It's very personalized. Things often needs to be tailored to the specific situation you're dealing with. One thing is what the study has shown, right? Is what the study showed up is 100% applicable to every single stallion around the block? I don't know. One thing that I personally question of many studies that are out there is that nobody tells you what stallions they were dealing with. Nobody tells you what was, for instance, the intrinsic sperm quality that those stallions that they enroll. So everybody says, I got a stallions that I collected and I tested this and this extender, but nobody tells me were these the stallions that have these sperm quality parameters versus these ones, because maybe if I do the treatments that they're suggested on this paper on the stallions with really good sperm quality, maybe it doesn't make any difference. But if I start to look at these on the stallions with low sperm quality, then maybe I can start to see differences. And our jobs as academicians is probably try to create the best model we can that could replicate what people are seeing in their practices or in their breeding farms.
Awesome. I don't want to go to too much of a controversial topic, but with all of the advancements in the equine breeding space, you have ICSI, you've got the IVF, obviously AIs. I wouldn't call it new, but it's there. Embryo transfers. Where do you think, or let's start with, what is the current state of those? Like, why try one over the other?
I think that it's interesting you're saying, because I'll give you my perspective with a specific example of ICSI. When ICSI started 25 years ago, the first foal from ICSI was born in 96. People in the early 2000s were doing it. Commercially started probably in Italy and the States 2005, 2010. And after 2015, it just was a exponential increase of ICSI. When ICSI started, it was promoted as a method to overcome mares of fertility. So the assumption was, well, they do this in women of advanced age with low oocyte yields, low number of oocytes, low quality of oocytes, and they get babies. It must work the same in horses. And then people come to realize that for ICSI, the problem, one of the big, in the single most important factor that affects the efficiency of ICSI, any program that has been peer-reviewed, published, is mare age. So mares that are older, they have lower number of follicles, they have lower quality of oocytes, they have higher early embryonic losses after those embryos have been transferred into recipient mares. We cannot overcome age, right? So, but after all these ICSI started, and you start to see laboratories opening every single year in different parts of the world, ICSI became like almost like a fashion thing, My neighbor is doing ICSI. I want to have to do ICSI too. My neighbor got 5 mares, 5 embryos from their mare. I must have the same 5 embryos too. And that's often how the industry works. Surprisingly enough, and we discuss that every once in a while with my colleagues here in the university, you will think that with ICSI, kind of like things go like in a wave. So everybody gets a really increased excitement phase, and then kind of like things wander down. ICSI has stayed there for a long time now, and I don't foresee ICSI going away, because ICSI became a really convenient way to get pregnancies for mares. Now, the population of mares that are getting ICSI done has shifted. It's not the old mare with low follicle numbers, low oocyte yield. It's the show mare that the owner wants to get babies and wants to get embryos frozen and wants to get pregnancies, but they also want to keep competing on her. So more and more in our program, for instance, 40% of the population of mares we're seeing here are less than 10 years old.
Wow.
And why is that? Well, it's convenient for the owners. The mare goes, is the procedure done, depending on the facility. Some facilities, they do like this drive-through aspiration. So mare goes in, goes out. Some other facilities, the mare doesn't have to stay more than 2-3 days, and then she goes. And she can be running barrels the following week, or she can be just doing something else the following week. And those mares are also the ones that are being booked to these stallions that maybe have low semen supply or might be diseased. So the two driving factors that I'm seeing nowadays that are driving the 6C fever is mare age, younger mares that are in competition, or stallions that are very popular but have low semen supply. Those are the biggest two driving factors what people do. With that being said, more and more people are getting into this ICSI fever, and everybody wants to do ICSI, but not everybody is 100% aware of what are the limitations or what are the expectations, how I should say, about ICSI. Everybody assumes that you do ICSI, you get embryos. There are clients that don't understand the difference between an oocyte and an embryo. And everybody, if you tell some people, you tell them, we got 13 oocytes from your mare, they're assuming that every oocyte is an embryo. And so they're starting to count, I got 13, so I must be lucky. But then often people, and I think that that's a problem that whoever's doing the ICSI should be better at, is to telling people and explain them well what are the different steps of this procedure, what does they entail, what should they expect. Because every time you do something with those oocytes, you're losing numbers. Not just because you got 13 oocytes, you mean you got 13 embryos. These oocytes need to be mature, they need to be fertilized. Some of those might cleave, some of those might not cleave, some of those might become blastocysts, some of those might not survive the transfer. So all those things need to be explained so that owners can understand what kind of economic investment they're doing and what kind of expectations they should get from that. Same thing with the IBF stuff. The IBF is a really cool stuff. I mean, we are really excited here in the lab. We published a paper about that last year. It sounds amazing, but right now, I personally don't think it's going to be able to overcome ICSI because one of the biggest limiting factors for this IBF protocol that has been published is sperm quality and quantity. You need to have good sperm quality to be able to have embryos made of by conventional IVF. And guess what? Some of the stallions that people want to do and want to get embryos from, they don't have that sperm quality or they don't have those sperm numbers. So that's where ICSI might become a better alternative than IVF. There's still a lot of rooms for improvement. There's still a lot of stuff that we don't know. So we'll have to see what the years will bring in terms of how this IVF protocol is going to work or not, if it's going to produce better quality embryos or not, if the babies are going to be more healthy or not. Not saying that the ICSI embryos are not healthy. They are quite healthy, and there is enough evidence that shows that ICSI pregnancies are as healthy and foals derived from ICSI are as healthy as foals derived by AI, rainbow transfer, or live cover. I just think that we still need to get more information before we cannot come up with our own conclusions. But this is for the people who can afford and say they don't have a problem spending $12,000 doing an ICSI cycle and paying for a recipient mare on a stand fee. There are also breeders that they don't want to pay that or they don't have the possibility for that. And for those owners, artificial insemination, maybe embryo transfer could be still a good alternative.
Where do you see the industry going in the next 5 to 10 years?
There has been a shift in the industry in terms, at least in embryo production, that is somehow similar to what happened in the cattle industry. In cattle, I don't know, 20, 25 years ago, 60, 70% of the embryos produced were produced by superovulation and embryo transfer, embryo flushing. 85% of the embryos are produced by IVF. Now in the horse industry, we're probably having that shift already. I think that most of the embryos that are produced in the world are ICSI-derived embryos. So probably that trend is going to continue for sure. Besides of that, I think that it depends a lot on the industry you're working with and the clients you're working with. Because in contrast with the cattle industry, that your goal is to produce milk or meat, there is a necessity, an economic necessity. In the horse industry, there is an economic necessity, livelihood of some people. You know, people are not looking to produce 3,000 foals a year, right? They want this foal, they want this mare, they want this stallion, they want to recreate these pedigrees. So then when they take it as a 3-year-old to the futurity, it's going to win this competition and maybe moving forward. But, we are not seeing, I think that we're not seeing that exponentially. We're seeing an increase in exponential number of mares that are being bred to a specific stallion. I think that we have reached out to a certain plateau. Maybe the most popular stallions are the ones that are breeding a big portion of the mares, but it starts to stabilize because obviously, it's expensive. It takes time. It's not 100% efficient, whatever method of breeding you're using. So maybe it kind of like self-regulates. I don't know if we have reached out kind of like the top of what we should expect unless a new technology comes out down the road. I don't really know. I don't know. I think that right now we probably have done a lot of the stuff that we could do and it's sufficient for a lot of people.
Yeah. Well, I appreciate your time so far, and I've got one last question for you. And that is, what is something that you wish more practitioners would adopt?
I think that I'll give you an answer from the perspective of somebody who likes to work with stallions and have a strong focus on stallions. And I understand how busy private practitioners are. They're really busy. Things like looking at a sperm morphology sample from a stallion. So stallion they bred a mare with, and they have questions about that sperm quality. Just save a little aliquot, make the slide yourself. If you had some time, 10, 15 minutes to look it out. Just get yourself an idea of what it is, not just blindly go and put some semen in the mare uterus and let's move on to the next appointment. I get it. It takes time. I think that things like the diagnostics, our job as veterinarians is to be diagnosticians. It's our first job. We're not here just to treat an animal. We're here to first diagnose them, properly know what they have and treating them accordingly based on our diagnosis. Things like endometrial cultures and cytologies, endometrial biopsies, often are taken for granted. Often people, they say, I don't have the time, or what for? These things were not invented 2 or 3 years ago. These things have been reported and invented 40, 50, 60 years ago. And after people forget about them, often people just say, I don't have the time for that, or I'll just take it to a diagnostic lab or to a commercial lab and they'll read it for me. And it's fine to a certain degree, but more and more I'm seeing cases in which people say, I got a stallion that is infected because I sent a semen sample to the lab or a penile swab to the lab, and the lab grew this bacteria. And I asked them, did you look at the bacteria yourself? Did you look at the semen? Did you see bacteria in the semen? No. How do you know the stallion is infected? It's a simple, trivial thing. It's an essential thing, and often people forget about that.
Yeah.
Often people forget about the basic stuff. And I think that's before we move forward as veterinarians to try the cool stuff, we should never forget the basic, essential stuff we have been trained into.
Awesome. Yeah. I think so many people, no matter what industry, tend to overlook or even just think they're too good for the basics. It's a syndrome called the Dunning-Kruger effect. If you know the Dunning-Kruger effect, so many people, especially the less experienced, they think, well, I know all that stuff already. What is the techniques? I want to move on to that. But yet they forget, like you said, hey, are you drying the penis? Are you doing all these things that are what would be considered, breeding 101?
Yeah, that's exactly right. And it happens in practice. It happens in academia. It happens in life, and often that's the problem.
Yeah. Well, Dr. Camilo, I could sit here and talk to you for hours, but I know you don't have that time. So maybe we'll bring you back on for, some more conversations in the future. But I really do appreciate your time. If there's anything you need from us at Boot to Farm USA, please feel free to reach out. We just respect you and hope all the success in the world for you.
Thank you.
And if there's anywhere that, if people wanted to reach out to you, doctor, where would be a good place for them to reach out?
They can reach out to my email. My email address is chernandez@cvm, as Charles Victor Mom .tamu, as Texas A&M University.edu. I'm easily reachable by email. So any questions you guys might have, anything that we can discuss, I'm here. I'm here for that. So
awesome.
Absolutely.
Yeah, and I thank you again for your time. I really appreciate it.
You betcha. Thank you, Ty, for the discussion. Certainly, it's good to talk about these things.
Yes, sir. And I want to thank you for taking a listen to this podcast. Feel free to share, like, and subscribe. And if you have any other recommendations of either guests or topics, please feel free to just comment or email. And I'll put all of our contact information, even Dr. Camilo's email, in the show notes. And with that, we'll talk to you later.
Thank you.